please, let's put a sense of scale and balance and responsibility. If not as Filipinos, as Cebuanos at least. Because that is how it stands. I'm not creating these figures. The figures that I presented, where Cebu right now has 690 active cases. That's of July 11. And these are all verified. Even if DOH claims that we have 861, we're still number 96. That's an average of 27 active cases. 27 active cases per 100,000. And more than 90% of that are either asymptomatic or mild. But no, we must have our headlines. So we can proudly show it off that we have our headlines, regardless of who gets hurt. And we are so scared of this. The media continues to spread this fear pandemic about COVID-19. At first, I must admit, in those first few months where we knew nothing of this disease, I was just as scared. And I was the strictest local chief executive that imposed the strictest guidelines and protocols. But it's been over a year. We have figures that have not changed in any way. Mortality continues to be well below 2%. And that's by DOH figures. Let's confirm this by a third party. According to Johns Hopkins COVID Center, they have ranked the countries in terms of number of COVID-19 deaths per 100K ratio. Because that's the way you do it. You don't keep on counting numbers. You consider the population. I mean, isn't that the way it was? Why have we forgotten this? Why do we just continue talking about double-digit increase without even considering what the number of active cases are in accordance with its population? Well, Johns Hopkins hasn't forgotten this. And so this is the way that they ranked it. Number 1 is Peru, with a fatality of 9.3%. That would mean 597 deaths, 597.9 deaths per 100,000. Number 2 is Hungary, with 307.1 deaths per 100,000. Number 3 is Bosnia and Herzegovina with 292. Czechia, San Marino, North Macedonia, Montenegro, Bulgaria, Brazil, Moldova. These are the top 10. Where's the Philippines? Number 96. The Philippines, with 25,921 deaths, is 1.8%. That's 23.98 deaths per 100,000. Other diseases have had higher deaths per 100,000. And yet, we do not keep a daily media broadcast in order to hammer down this mistaken belief that COVID must be dreaded like a virulent disease that can kill half of the population. Figures don't lie. You can refer to the latest DOH case bulletin. Our mortality rate is still at 1.76%. But we must keep on announcing. Third wave, Delta variant, then the Lambda variant. I recall when I was in UP, there was this sorority called Delta Lambda. I wonder when the Apo variant and the Acro variant and the Tau Gamma variant will be coming out. What is the effect of all of these on the Philippine economy? You will see for yourself according to PSA data. In 2018, we had a growth rate of 6.3%. 2019, 6%. In 2020, negative 9.5%. Why? Because we told all businesses to close down. We asked everyone to stay at home. So businesses were lost, jobs were lost, livelihoods were lost, and GDP sunk down to negative 9.5%. For what? For a disease that has a 1.76% mortality, a 96 to 98% recovery, but because of our lockdowns and restrictions have definitely caused a more than 100% mortality to our economy. That's a long way to go. From positive 6% in 2019, we crossed that positive threshold and even went down to negative 9.5% in 2020. The inflation rate from 2018 at 5.2 went down to 2.5% in 2019. Went up to 2.6% in 2020, but in 2021, it has now gone up to 4.2%. What is the external debt? Well, you can see for yourself. Right now, it's 98.4 billion. Imports and exports from a high of 112 in 2018 and even just about the same in 2019 at 111, we're now down to 85.69 for imports. Exports are down to 63%. Unemployment. Present unemployment stands at 10.3% from 5.1 in 2019 and 5.3 in 2018. It has doubled in 2020. Underemployment has gone up from 13.8 in 2019 to 16.2 in 2020. What's my point? Surely, after a year, there has to be a roadmap. A roadmap in dealing with COVID-19 and getting on with our lives. We cannot keep on going back to our initial knee-jerk reactions at the time last year when we knew nothing of this disease and we did not have these figures. Why can't we have a sense of scale and proportion? Why can't we do comparative analysis, critical analysis? Why must we keep on focusing on whether there has been an increase of positive cases? Why don't we focus on whether we have in fact improved our hospital system in order to be ready? Should there be what many, well, not many, but some, for some twisted aim, wish would come upon us, a third wave, another surge, just so they could make headlines. Is this how life is gonna be? Is this how we foresee the rest of our lives? Singapore gets it. After careful analysis, Singapore realizes that we can never achieve zero COVID, and this is what I have been saying. Let me read to you exactly what Singapore's game plan is. And I would like to ask those that keep on harping on increases in COVID-19 and because you have not been doing the social protocol, and we've heard that before. But what's the end game, and what's your game plan? What's your plan? Are you just to keep on repeating that you wear your face mask and wear your face shields and keep on blaming people because they forget that they are not robots and they are humans after all, and interact with other people? Is that what we will keep on hearing? It's been over a year. We've heard that. We've heard that before. And each time that cases decrease, you pump your chest and claim credit. You, who are so authoritarian over people's lives, and each time cases increase, you blame the people. Look, you've been at the helm. You've been up there. You've been dictating policies. My question is it the time to ask yourselves, why haven't you been able to manage this, and why haven't you been able to come up with a clear roadmap to getting on with our lives and picking up the pieces of a devastated economy? Let me read to you this article. Singapore's surprising new plan to live with COVID revealed. Singapore has announced it will soon fundamentally change how it manages the pandemic. A country that has been one of the world's most successful at combating COVID-19 has announced it will soon fundamentally change how it manages the pandemic. The city of Singapore has stated COVID will be treated like other endemic diseases such as flu. Finally, a city-state that gets it. Well, I'd like to think we got it too, because we've been managing COVID so far. But of course, some personalities would just hope to pounce at whatever opportunity they could to put Cebu in a bad light. Let me just say that we did help them. We gave them ammunition. What with such inflammatory headlines? By what I call would be irresponsible journalism, claiming that a third wave is in Region 7, but of course, focus would be on Cebu. Let me continue. As I said, the city-state of Singapore will now treat COVID like other endemic diseases such as flu. There will be no goals of zero transmission. Quarantine will be dumped for travelers, and close contact of cases will not have to isolate. You know what's happening now? We keep on testing. Someone tests positive, even if it's asymptomatic, immediately the entire family is isolated. A member of media keeps on texting me. They are all isolated. They have nothing, no symptoms, nada, but they cannot work. And while they cannot work, there's no food. So now they're accepting laundry so that they can buy a kilo of rice. You know, it is so fine to talk about policy of isolate every first contact. You forget that most of them are what you call isang kahig, isang tuka. What you earn for that day is what you will buy rice with. what you will feed your family with. And you isolate this person for 14 days. That's 14 days off his income capacity, income-making capacity. He cannot make any money to buy for his family's basic necessities. So Singapore gets it. Quarantine will be dumped for travelers, and close contact of cases will not have to isolate. It also plans to no longer announce daily case numbers. We are so fixated on announcing, sometimes with much glee, with much excitement each time, double-digit increase. It seems as though it's all that we are waiting for, so that we can make news and headlines. But Singapore says, announce daily case numbers. Why? Plain and simple. It does not achieve anything. It creates a misimpression because most of these are anyway asymptomatic or mild. So, why the need to broadcast each and every day the number of positive cases that have been tested? You know what they will do? They will just monitor those that are in the hospital, that actually need hospital care. Then they will be monitoring their hospital system. Senior Singaporean ministers have said it is the new normal of living with COVID. The bad news is that COVID-19 may never go away. This is what I've been saying all along. You want zero COVID? Maybe it's time for you to go to paradise. There are no diseases there. But for as long as you are in this challenging world of ours, there will always be diseases. You cannot hope to achieve zero COVID in the same way that we have not achieved zero tuberculosis, nor zero dengue, zero measles, even though we have vaccination every month, every year. Zero polio, it's made a comeback. And yet you want to achieve zero COVID? And you wait for that day? And in the meantime, we devastate an economy, and we put so many people out of work. So, Singapore's Trade Minister Gan Kim Yong, Finance Minister Lawrence Wong, and Health Minister Ong Ye Kung said in an editorial, as I said, the bad news is that COVID-19 may never go away. The good news is that it is possible to live normally with it in our midst, which is what we have been trying to do, and we are successfully achieving here in the province of Cebu. We reopened tourism last year when Cebu gained its MGCQ status in July. So it's been over a year now. We are still on MGCQ. Our resorts are full, especially on weekends. But what is the average of positive, active cases? According to the DOH claim of 871, that's 27 per 100,000, because we're 3.2 million. I'm sorry for those that are hoping and praying for a surge or a third wave. That is not going to happen. You know why? Because we have been employing the two-pronged approach. Something that perhaps some people up there should start thinking about. Instead of focusing on masks, face shields, social distancing, stay at home, and all of these authoritarian measures, draconian measures. You know what our strategy is? Boost the immune system. Take healthy foods. Take vitamins. Have enough sleep and rest. Live a healthy lifestyle. Go to the sea. Breathe in without your mask the sea air. Go to the mountains, breathe in without your mask the pure mountain air. It helps your lungs and it helps boost your immune system. Take in the heat of the sun, that's vitamin D. Sleep at least 8 hours. And please do not sleep with your mask on. You will have nightmares. That's one side. And in fact, you know, those that have been monitoring us have seen we have finished our second tranche of our caravan of government services where we distributed vitamins to all of our frontliners, including our senior citizens, including our PWDs. Free vitamins. We'd rather spend for that because it's preventive. At the same time, we are encouraging them to plant vegetables with our Sugbo program so that in any household, you can have the healthy, green, leafy vegetables that you need, as well as others, tomatoes, fruits, and whatnot. What's the other side? Use science and technology. Use air purifying systems with HEPA filters, UV, ultraviolet, sterilizer lamps, personal air purifiers. These are now available, you know, at very, very affordable prices. That's what we're doing. We do not keep on repeating social distancing. You are not face mask with face shield. No gathering. We've heard that before. But has it achieved anything? Do you have a model to show as a successful implementation of your so-called protocols? And in fact, it brought down the spread and transmission of COVID-19. But as I said, what I've noticed, whenever cases drop, you take the credit. You who have appointed yourselves as the gods over people's lives. And when cases increase, you blame the people. I have a model, the province of Cebu. In spite of what Dr. Vergeri said, that we have double-digit increase, hello, according to your figures and your own data, we are ranked number 96 in the total number of provinces and cities in the active COVID case incidents per 100,000. Because you see, we're the most populous province at 3.2 million. We've been able to manage it. But I never said, go back to all of my other broadcasts. I've never, ever dared to say, I will achieve zero COVID. No. All along, I've been saying it's about COVID management. And the most important part of that is prevention. Is the wearing of face masks and face shields the only way of preventing? We've been wearing face masks for a year and face shields for a year. Have you been able to, well, since those are your protocols, perhaps it's time for you to say we are successful. See, our cases are going down. But now you talk about Delta variant and Lambda variant and Delta Lambda. Sorority na sa UP. But we have a model because we started that last August with my Executive Order 20 and 20-A. We defined for each and every tourism activity the specific protocols that had to be followed. And it was always, and as it continues to be, a two-pronged approach. Boosting one's immune system and using science and technology. It's as simple as that. And no matter how much you may wish that Cebu province will stumble and fall, no, I will not allow it to. I am here. I am staying here to defend this province and see to it that this will continue to be a model for the entire country, for others to see that after all, it can be done, that we can do it right. By the way, coincidentally, Singapore's population is 5.7 million. The total population of Cebu is 5.1 million. That's one similarity. Second similarity, we have no other agenda but the welfare of the people. Singapore is known for its very efficient, professional, and corruption-free kind of governance. We strive to do the same here in the province of Cebu. According to these three ministers, Minister of Finance, Health, and Trade, the virus will continue to mutate and thereby survive in our community. And so are we going to jump at every possible variant that you suddenly, by genome sequencing, discover? That is the nature of all viruses. They mutate and mutate and mutate. And there will be variant after variant. I am really waiting. We now have the Delta Lambda. I am waiting for the Tau Gamma Rho variant. It says here, Singapore never got to zero. Now doesn't want to. Like most countries, Singapore had an initial peak of cases last year, topping out at 600 cases a day in mid-April. Following a smaller wave in August, COVID-19 hasn't cleared up since. However, the nation of 5.7 million has had a steady undercurrent of 20 to 30 cases every day. The nation has recorded 35 deaths in total because they have an excellent health system and they have an honest assessment of true and real COVID deaths, not including motor vehicular accidents. Singapore has strict border controls in place with most countries, including tests on arrival, hotel quarantine, and stay-at-home orders. It's not dissimilar to Australia, which, by the way, some of you wish to always cite. See, Australia has lockdown, we should do the same. But Singapore varies the demands on travelers depending on the risk. But, this is more important, but all that would be eventually done away with under the plan put out by Ministers Kung, Yong, and Wong, who make up Singapore's COVID-19 multi-ministry task force. Every year, many people catch the flu. The overwhelming majority recover without needing to be hospitalized and with little or no medication. And that's what's happening also. With so many, those of you who are watching me now are aware of this. Even you yourself, you have had some symptoms and you recover with little or no medication. But a minority, especially the elderly and those with comorbidities, can get very ill and some succumb. That's with the flu, that's with other diseases, because that's life. There will always be deaths. But I am just wondering, nobody cares if someone dies of a heart attack or someone dies of a vehicular accident. That doesn't get posted on Facebook. But when someone dies and says it's COVID, it's splashed all over. Is it because someone who dies of COVID is more important? Or it serves the agenda of some? According to these ministers, we can't eradicate it, but we can turn the pandemic into something much less threatening, like influenza or chickenpox, and get on with our lives. Instead of monitoring COVID-19 infection numbers every day, we will focus on the outcomes. How many fall very sick, or those that can now be categorized under severe and critical? How many in the intensive care unit? How many need to be intubated for oxygen, and so on? This is like how we now monitor influenza. So I ask the powers that be, those that come up with these daily updates, like Dr. Vergere, what's your game plan? What's the end game? What is your roadmap towards graduating into a new normal? Are we going to continue to focus on chalking up numbers and talking about variants and doing a back and forth for quarantine classifications, atras abante? Or isn't it time that we take a cue from Singapore, where Singapore has stated that they will live with COVID? Well, this is what we've been doing all along here in the province of Cebu. I have seen the suffering of so many, precisely because of the restrictions of COVID, not because of COVID, but because they have lost their livelihoods and their jobs and their businesses. And I cannot allow that to continue to happen to my beloved Cebuanos. So I'm going to take a cue from Singapore. It bears notice that this island state, this city state, is showing the world how to live with COVID. I hope that puts to rest this issue. Let me repeat, we're managing COVID here in Cebu. We've learned from all that has happened in this over a year learning period. If at this point we keep repeating the same tired old phrases that we've been saying at the start of this pandemic, then it's either way, you haven't learned anything, or you wish for COVID to continue till kingdom come. And if that is the case, then there must be another agenda.